One of the question is, could anesthesia influence the stone-free rate? So what does the panel think about it?
Shall I? I'll just start quickly because we're reasonably polarized within the UK. We don't generally give sedation, and we never give a general anaesthetic. I've already seen that my expert friend and colleague Debbie Corey is online, and it's great to have her expertise join the participants. And I love the phrase about, chat to the patient, engage him or her. And that's exactly what happens in the best analgesia is a relaxed patient. So we give a little bit of analgesia beforehand, maybe just some paracetamol, maybe in some patients diclofenac suppository, which actually also helps with a bit of vasoconstriction in a good way as part of the ramping. But we don't give an anaesthetic at all. We just talk to the patient and make sure that they're comfortable and therefore lying still. That's the UK perspective.
What about you, Dr. Pankaj? How do you do in India?
So even we do not want to give anesthesia unless we get cornered to it. Means obviously a pediatric ESWL would need anesthesia. There are some young women who are extremely apprehensive, extremely sensitive to lithotripsy. There you may need to give some sedation or anesthesia, but more often it should be done, chatting to the patient, giving some peri-procedure analgesia. Although I should say that there is a literature which says that if ESWL is done under GA, the stone-free rate is marginally higher. But what my personal feeling is that by giving GA, you are really reducing the non-invasive advantage of ESWL. So unless I am really cornered, I would not want to give general anesthesia.
Kemal, does that mirror your practice? Because I know you do pediatrics.
Daron, I agree. I totally agree with you. In our practice also, we apply general anesthesia in pediatric cases, only in pediatric cases. But when it comes to the pediatric cases also, we published a paper based on the age of the child. The children over the age of 10, they tolerate this treatment very well with painkillers and to be cooperative with us if they are cooperative. Otherwise, younger children, they will need general anesthesia. That's for sure. We apply, but in adult cases, no general anesthesia, only a single injection of painkiller, non-steroidal anti-inflammatory agent is enough in our daily practice, and they tolerate it very well.
Okay.
So what we have also seen is that if you let the patient attend one lithotripsy session, and that is what we used to do when we had a very busy ESWL practice, that this next patient would be brought in and he would see the treatment, he would understand what is happening. Then they tend to cooperate much better, and the need for anesthesia and analgesia would dramatically reduce.
Yeah, it's a lovely idea. We'd need to do that with an anonymized video now. We certainly wouldn't be allowed to have one patient in. The system would go absolutely wild within the NHS for that. I'd never be able to do a webinar again. I'd be